Our top stories this morning, CBC News has learned the federal government is working to increase the supply of crucial medical supplies in the country. The Prime Minister is set to make an announcement on that this morning at 11:15. Senior government sources tell CBC News Ottawa wants to work with manufacturers to boost ventilator production. There's currently no shortage, but officials want to make sure there will be enough as cases of the coronavirus rise. We're going to talk about this because not just the appeal to manufacturers to boost their production, but we've seen in the last couple of days really an extraordinary response from the private sector coming up with ways to retool or to produce something that they don't normally produce, come up with ideas to provide the supplies that are so critical: masks, gloves, hand sanitizer, and ventilators. And that's what we're going to talk about now with a very special guest from Montreal. Reza Farivar is the organizer behind something called the Code Life Ventilator Challenge. He's the Canada Research Chair in Integrative Neuroscience at McGill University, so he is in Montreal. And Professor, welcome to our program today.
Good morning, and thank you for having me.
I'm delighted to introduce you and to hear about this initiative, because it just really speaks to people coming together and trying to get through this crisis together. Tell me, number one, about the challenge, Code Life Ventilator Challenge. What are you doing?
So the challenge is meant as a catalyst to basically get some of the best ideas forward for simple to design or simple to build, simple to use and maintain ventilator that could be used around the world, manufactured locally, and to basically get people through this COVID crisis.
So it's a contest.
That's right.
We'll talk about the terms in just a second, but what is it? What is the need that you feel that you're answering by setting up this challenge? What sort of touched it off?
I think we were all very heavily affected by the news we were getting out of Europe, particularly before that out of China, about the need for the severe COVID cases needing invasive ventilation in most cases, and that the shortage was because of a device. And this is, it's one thing to read that the disease has taken over and it's not, you can't do something, but when you know that it's simply a device that's missing, you'd feel that there should be a fix for this. So that motivated us to start looking into exactly what is needed just to deal with this case, not necessarily sort of all-purpose ICU ventilators, but a ventilator that could serve these patients in current urgent need.
In the most urgent need. Is that right?
That's right, exactly.
Because we're talking a lot about ventilators, and I'm thinking that maybe people with no medical experience might not realize how crucial they are. Can you explain why we need to have enough ventilators in place for people?
So I'm not a medical expert. I would definitely defer questions regarding exactly what mechanical ventilation, what patients require it. But effectively, in some of the more sort of as described in the media, some of the more severe cases, people have a hard time breathing and getting enough oxygen, and a mechanical ventilator basically helps them have enough oxygen so that their immune system can effectively fight the disease and get through.
For those who are the most affected by this COVID-19. Now, you launched this challenge, international, for this is starting off a 2-week period, but we were just talking before we came on air together. You launched it just 2 nights ago. What kind of response have you had?
The response has been amazing. So far, we have about 74 entrants this morning.
In 2 days?
In 2 days, absolutely, yeah. And there's a lot of other outpour of support behind the scenes that's hard to appreciate. For example, the Montreal General Hospital Foundation jumped on this very quickly when we first talked about it on Thursday. So by Saturday, we already had support from them and the MUHC leadership. That's McGill University Health Center. And it was without their support, this couldn't happen. We had a whole team of advisors, ICU and mechanical ventilation experts from Montreal and from Toronto chiming in on the minimum specification required. And then very quickly again after, we've had an outpour of support from engineering experts, compliance experts, manufacturers from around the country and even around the world, asking how they could help. And so we're basically organizing them into various different teams. And yeah, the outpour of support is incredibly touching.
It's rather heartening, to say the least. As you were mentioning, one of the keys here, it has to be not simple, it's a ventilator, but not require special manufacturing, something that could be made at the local level. Have you seen the proposals so far? I mean, can you explain some of the things that they are pitching that maybe a non-expert like myself and our viewers might understand?
No, unfortunately, I
Okay.
have. Excuse me. We don't yet have any eligible designs yet, but mechanical ventilation is fairly established, and so there are older designs that can suffice for this crisis. So it's very likely that some of the designs will be sort of inspired by these more established older designs.
And maybe would they be using 3D printing? We saw some images this week of how someone in Italy has come up with a 3D printer version to help because they, as you said, the need is so great there. Might they be using some of these new technologies and creating thing that obviously is something that's widely available and accessible to people now?
You know, in order to make sure we don't constrain innovation, we don't want to limit what people come up with. The criterion that they have to meet is obviously that it will be a medical device. It needs to, you should be able to clean it and maintain the similar safety features as you have in other medical devices. So it's possible that some of the designs may be 3D printed, some of them might be machines, some of them might just be cut and built from sheets of material. So we really don't want to limit what people come up with. We just want them to figure out how to do this in a way that's most broadly usable.
Turn their minds to the task at hand and just open it up. The prize is $200,000, the reward for that design. And just help us understand, when people do put these designs forward, will they be able to be used quickly and within this country? Is that the aim, that we'll be able to access this quickly, and then should the need arise, there they are?
That's an excellent question. That's another thing that our experts are working around the clock to ensure. So what we have is already we have the advisory panel that describes the minimum requirements, and those are specified on the website. I refer everybody to check that for the latest information. Then we have the jury that'll help whittle down the selections into the most feasible ones. And then again, our panel of experts will go through those to select the final three. At the exact same time, sort of already in parallel, we're going through and setting up validation and testing protocols so that we can effectively do very accelerated verification of these devices. And we're also linking with builders and manufacturers so that they would be ready to build a feasible design fast. So yes, the hope is that by mid-April, when the finalists will be announced, that at that time one could actually contact a local builder, a local manufacturer, and order versions or copies of this ventilator.
It is very exciting to hear, and thank you for telling us about it. The deadline is March the 31st, and why don't we touch base with you again, Professor, and we'll see about the top three designs. People will be able to download them immediately once you settle on those final three and how this has gone. I appreciate the time. What a fantastic idea. Thank you for telling us about it.
Thank you. Thank you very much.
Reza Farivar is with us this morning, the organizer behind the Code Life Ventilator Challenge on now in Montreal.